Diseases can be difficult to treat, especially highly contagious diseases like tuberculosis. TB remains one of the deadliest diseases in the world, and it has a staggering 50% mortality rate for those not treated for the disease. That's why TB patients may be required to participate in directly observed therapy, or DOT. DOT requires a trained healthcare worker provide the prescribed TB drugs and witness the patient take every dose. It allows the healthcare worker to closely observe the patient for adverse reactions from the disease and the treatment itself. The traditional method of DOT requires a healthcare worker drive to the patient's location, which has been mutually agreed upon. For patients still in isolation, the healthcare worker visits the patient where they are isolated. This method brings the disadvantages of long travel times, added fuel expense, and puts the healthcare worker in direct contact with a contagious individual. It can also be an intrusion on the patient's privacy if a healthcare worker comes to their home. But the St. Charles County Health Department has eliminated some of these disadvantages by utilizing a new form of directly observed therapy called EDOT, Electronic Directly Observed Therapy.
EDOT, or electronic DOT, allows our public health nurses to perform DOT, but by a video call as opposed to going to the patient's home on a daily basis.
So here's the process that I go through with establishing EDOT with my patients. I establish a good time for the Skype or FaceTime call to occur, and the patient calls in during that time. Once we're both visible on each other's screen, then I have the patient hold up the first medication so that I can see the medication on the screen. They dispense the medication into the lid and show me the dose. So there's 1 pill, 2 pills, 3 pills. I need to see that. The patient takes that first med, takes a good sip of water, holds up the second med, lets me see the label, doses it out again. We just repeat that process till the patient's taken all of his or her medications. In terms of determining eligibility for EDOT, we do meet with the client. We discuss the program, the advantages, the disadvantages, the requirements. They have to be technologically comfortable with Skyping or FaceTime. We also meet with them daily for a minimum of 2 weeks, to build that rapport, to make sure that they understand their treatment regimen, and to answer any questions that they have about EDOT before we move on.
This program certainly is a benefit to the patient, but it is also a benefit to the local health department. For example, if we had a patient that lived about 10 miles from the health department, that would be 20 miles of travel time there and back for the nurse, including the 10 to 15 minutes that they are out of the office for the visit. So if we look at that in terms of cost, that would be probably about $7 in mileage or fuel costs, in addition to the nursing time, which would probably be $14 to $20. Over the course of 9 months of therapy or 180 visits, that would be $2,500 in savings to the health department with one patient doing the EDOT.
If I had to think of any potential disadvantages of EDOT, some may say it limits our face-to-face time with our patients. However, I will say that we do require a face-to-face in-person meeting with our patients at least once a month, and even more so if the patient expresses concerns, talks about having side effects to the medications, or just wants some one-on-one time.
There are many agencies that are currently using some form of EDOT, and like other agencies, St. Charles County was drawn to the idea for a number of reasons. It's convenient, not just for our public health staff, but also for the patient. It ensures compliance. It gives us greater access to the patient, which means that our DOT is being done on a more frequent level.
Electronic Directly Observed Therapy, or EDOT as we call it, is a wonderful program for our clients because it allows us to have daily interaction with our patients. It allows them to remain compliant with their TB medications. It also allows our clients to return to normal activities such as work, school, engaging in activities with their children.
So EDOT has shown to be very beneficial for tuberculosis management, but there are other applications where it would be useful. For example, many local health departments were monitoring Ebola travelers, so people that had traveled to Ebola endemic countries and then came back or resided in the United States. Local health departments needed to monitor those people. This would be a good way to monitor them without having to have staff go to their homes or make daily in-person visits to them. You could do it by electronic means.
Getting the EDOT program up and running here in St. Charles County did take several months to get policies and procedures in place. But in the end, we have a product that we're very proud of. It's working successfully for us for over a year now. And I think when you have a product that works so well for a county or a health agency, that it's important to share that with other public health agencies, letting them know this is something that works really well for us. And if it's something that you're interested in implementing at your county level, then you can contact us. We'd be happy to share our struggles, our strengths that we've had with the program. We'd be happy to share our policies and procedures and answer any questions that you may have.